Hello and welcome to another episode of the Health Notebook. Today we're discussing renal failure and we have Dr. Arendse in the studio. Dr. Arendse, welcome to the studio.
Welcome, thanks a lot.
Dr. Arendse, can you just tell us a little bit about yourself, where you've come from, where you are now?
My name is Craig Arendse. I am a nephrologist practicing in the private sector. I come from Cape Town, born and bred in Cape Town. I did my training as well as at the University of Cape Town, and did my undergraduate and postgraduate training through Groote Schuur Hospital, and gained my speciality also through Groote Schuur Hospital.
Okay, so just to explain to the viewers, you say that you're a nephrologist. Just to make the viewers aware, what is a nephrologist?
Well, nephrology is the arm of medicine dealing with kidney disease.
Okay.
So I decided after my speciality in medicine to specialize further in the field of nephrology, dealing mostly with patients who have kidney failure, obviously, but also in trying to prevent kidney failure. We deal with patients predominantly needing dialysis treatment. Also dealing with transplantation of patients needing kidney transplants, and obviously much more before that in trying to prevent kidney failure and patients going on to dialysis and transplantation.
Okay, so it's one organ. Obviously you have two kidneys. Can you maybe even explain to the viewers, how does the kidney work? Just some background as to how does the kidney work?
Right, so the kidney does I think a lot more things than many people think or believe. Besides the making of urine, obviously the removal or the removal of toxins from the body is very important, which is what we see when people have kidney failure. They have an accumulation of the toxin build-up in their body. The kidney is also obviously vital in the maintenance of your body's fluid balances. And that's another symptom when people have kidney failure. The fluid begins to build up in your body. But besides that, the kidney is also vitally important in regulating not only your body fluids and toxins, but also in maintaining your blood counts, particularly your red blood cell count, as well as your what most people don't know is your kidney is vitally important in maintaining your bone mass and the health of your bones. So when kidneys fail, those are generally the organs that are most affected. It's your blood system with the accumulation of toxins and the reduction in blood cells, as well as your bone system with the softening of bones and the bone disease that goes along with kidney failure.
Okay, so when we're speaking about kidney failure, how prevalent is it in South Africa?
Yes, that is obviously somewhat underestimated, simply because we are not that good in South Africa as in many countries where the health systems are not as robust as in the first world countries. We're not that good in detecting cases of of diseases like kidney failure. The more important diseases that one would probably want to follow or track when you're looking for kidney patients are simple diseases like hypertension and diabetes. In fact, those two diseases being the most important cause of kidney failure and kidney disease. Okay. So the prevalence of diabetes and the prevalence of hypertension goes hand in hand with the prevalence in the long term of a disease like kidney failure.
Yeah, so just to explain to the viewers, it's not to say that you have high blood pressure and diabetes, you will end up with kidney failure. It's the controlling and managing of it. Yes. Is that correct? Yeah,
so patients who have high blood pressure, if we use it as an example of pre-morbid conditions that cause kidney failure, if you have very poorly controlled hypertension and poorly controlled diabetic disease, the chances are very high that you will eventually develop some form of either kidney disease, which not necessarily one would refer to as kidney failure, but some form of kidney disease. But certainly those two, as we've mentioned them, are the main cause of kidney failure, certainly if poor controlled, not detected in the first place, or detected very late in the disease process, and if not managed properly, then they would cause kidney failure.
So besides high blood pressure and diabetes, what other risk factors are there for for kidney failure?
The risk factors for kidney failure are the same as one would traditionally consider for patients who have vascular disease. In other words, it's the same risk factors for patients who are at risk of heart attacks, for instance, or stroke. So in broad terms, patients who are generally overweight would be at risk of not only high blood and diabetes, but in the same vein at risk of developing kidney disease. Patients who are smokers, they develop vascular disease in general, so they would also be at risk of diabetes. I always tell my patients that you must remember or think of the kidneys as 2 bags of blood vessels.
Okay.
And yes.
I just need to go back. You said the person that smokes is at risk of diabetes, and you were supposed to say.
Yes. Okay.
Okay. So.
Yeah. So a person who smokes is at risk of vascular disease, and anyone who is at risk of vascular disease would be at risk of developing kidney failure or kidney disease.
Okay. So what are the signs and the symptoms, or just to explain to the viewers how can a person present?
Yes. It's very subtle. The symptoms of kidney failure can sometimes be very subtle. In fact, you can lose as much as 90% of your kidneys before you manifest any symptoms or severe symptoms that would suggest that you have kidney failure. The most important ones being general tiredness and fatigue. A very important clue is, and what people sometimes take lightly, is, for instance, swelling of the legs, swelling of the ankles. The development of shortness of breath with exertion is often an indicator to heart disease, but then we also find kidney disease in conjunction with that. Generalized itching of the body, nausea, vomiting, poor appetite, and weight loss or weight gain. If you're gaining a lot of weight unexpectedly, that could be as a result of accumulation of fluid, for instance.
Okay. So run me through the process. You have a patient with suspected kidney failure. What investigations do you actually conduct on the person?
The investigations are really very simple, and one would do a simple blood test. A simple blood test drawn can tell you, at least give you an indication as to how well your kidneys are dealing with toxins, and those are the things that we measure on the blood. The pathology labs are able to give us a calculated estimation of kidney function, and that we use to then predict how much percentage the kidney function is at. More importantly, though, in screening for kidney failure, one could do an even more simpler test, which is just a simple urine test. And most doctors, or in fact all doctors, all GPs, are able to do a test where one is able to just test your urine, dip a stick into it, and that can then test or establish whether you have an abnormal amount of blood or protein in your urine. And those are the sure signs of some or other form of kidney disease, which then needs to be investigated further for.
And what about scans?
Yes, once you reach, once you get to into the hands of a specialist or even a physician, for that matter, you then go on and do a scan of the kidneys. Generally, it's an ultrasound scan. And those gives you an idea of your kidney, the state of the structure of your kidneys, and some indication as to how well the blood is flowing to and from the kidneys. We often pick up other conditions such as obstructive diseases where the urine doesn't flow well out of the kidneys, which often relates to kidney stones and those kind of conditions. Or once again, coming back to arterial disease, where we pick up that the blood doesn't flow well to the kidneys, or there's blockages of the arteries, one or both arteries leading to the kidney. And that's probably the most common thing we find is arterial disease.
Okay, so now you have the kidney failure confirmed. What's the next step in terms of management?
Yes. So the most important thing going after confirmation of kidney disease is then to establish, first of all, how far it is and how far you are from the very extreme scenario where you need, for instance, dialysis treatment. And that's what most people want to know. Most people want to know, can I use medication, for instance, in the form of blood pressure tablets, or medication to relieve the symptoms, for instance, treatment to help get rid of fluids, diuretic therapy. And then once you start educating people about what the likely outcome is how far are you away from needing dialysis treatment.
Okay, so there's a threshold for dialysis.
There's a threshold. Once you reach a kidney stage of stage 5 kidney disease, or once you become extremely symptomatic from the negative effects of kidney failure, the toxin buildup and the fluid buildup, and usually that is around about when your kidneys are functioning at around about 10%, then we would start counseling the patients about the need or the necessity for dialysis treatment and or transplantation if they would then qualify for that kind of treatment.
Okay, so you actually also, besides managing the kidney, you're also addressing the cause of it. So if it would be
Yes.
diabetes or high blood pressure,
Yes.
it will also require optimal management.
Exactly. Yes. So you know, there's very few drugs directed specifically at healing the kidney, so to
Yes.
say. Most of the treatment is directed at treating the cause, treating the blood pressure, treating the diabetes. There's obviously another category of diseases that I haven't spoken much of because they're not often that commonly found, which is conditions that cause inflammation of the kidney. And there one would use drugs, anti-inflammatory drugs, particularly cortisone-based drugs, or anti-inflammatory, other anti-inflammatory medication, to halt or to slow down the process of inflammation within the kidney.
Okay, so I know the kidney failure is normally divided into acute and chronic.
Yes.
Can you just enlighten the viewers where the classification comes in as well?
Yes, the classification of acute versus chronic kidney failure from a textbook point of view, shall we say, is very simple. If your kidney failure is abnormal for longer than 3 months, you will be categorized as having chronic kidney disease. Obviously, the rate at which your kidney function deteriorates determines whether you have acute or chronic kidney disease. I've seen patients who have gone from having completely normal kidney function and completely disease-free to having acute renal failure and having absolutely no kidney function and needing dialysis within a matter of 3 to 4 months. And that would be classified as acute kidney failure. More commonly, acute kidney failure happens in the context of patients who become very unwell from, for instance, infection, or patients who end up in having some form of trauma, for instance, motor vehicle accidents, where the kidney shuts down instantaneously from the severe degree of illness that they present with. And then one often expects that once the rest of the body heals itself, or the condition that has caused that is resolved, and then the kidney function usually recovers subsequent to the recovery of the patient.
Okay, now we're looking at preventative measures in terms of diet. Can you maybe just advise the viewers in terms of diet as well? Now you've got the confirmed person that has the kidney failure. Now, in terms of diet, what can you advise the patient?
Yeah, that's a more challenging question, because diet in itself is not the primary cause of kidney failure. And so, although people want to go to diet very soon after they've heard that they've had kidney failure, there's very little one can do to prevent yourself from having kidney failure by means of a specific diet. Once again, we come back to the classical case of a diabetic. You know, for a diabetic to follow a diabetic diet is very challenging, as most diabetics would know by most diabetics who are watching this would know. So simply to follow a diabetic diet to the T is good enough, one would say, for a kidney failure patient to control the diabetes and hence control the kidney failure.
Yes.
Having a prudent diet, in other words, one that doesn't cause you to become excessively obese, or one that doesn't cause you to have excessive amounts of cholesterol, in other words, your fat intake or your salt intake, is probably more is probably the more pertinent issue than to say that there's a specific diet that one would do or one would give yourself to prevent yourself from getting kidney failure.
Okay, so we've spoken a little bit about the diet. Can we just touch a little bit on dialysis? What is dialysis as well, just to inform the viewers, and what happens with dialysis? I know it's for patients that have kidney failure and they're in a certain stage. So just give the viewers some background information.
Yes. So as I mentioned a bit earlier, once you've reached the stage of kidney failure, let's call it for the sake of the viewer stage 5, which is the last stage of kidney failure. We then start evaluating you on the basis of your symptoms and on the basis of what the blood tests tell us in terms of your degree of toxin buildup and how ill you are feeling from the effects of kidney failure. And when the time comes when your kidney function is too weak to sustain you or to give you a healthy, to give you a general body health, then we have to consider dialysis. Now there are two forms of dialysis. There are forms of dialysis called hemodialysis, and as the name implies, it's a form of dialysis where we attempt to cleanse the blood. In other words, we draw the blood out of your body and run it through a filtering system, and which removes the toxins and removes the excess water, and we can then pump the blood back into the body. There are other forms of dialysis which we call peritoneal dialysis, and that's a form of home dialysis, if you like to call it that, where we teach the patients themselves to do a form of dialysis where you infuse fluid into your peritoneal cavity, which is the cavity around your abdominal organs. And that is the kind of dialysis you do at home, and 4 times per day usually, where they have to do these exchanges of fluids. And then, of course, the third type of option that is available to someone who goes into kidney failure is kidney transplantation. And kidney transplantation can either be from a transplant offered to you by someone who is alive. In other words, a live donor offers you a kidney transplant, and that in our country you are able to donate a kidney or receive a kidney from your own mother, father, brother, sister, and even an unrelated donor is able to offer you a kidney.
Okay. Just going back to dialysis, I know you've highlighted to the viewers about the fluid being inserted, and just explain to them the mechanism involved in terms of inserting a port and what that port. So it might sound a little foreign for them when you speak about the fluid, but just explain to them what actually happens.
So in order to draw your blood out of your body, we need to create a what we call a port, or insert literally a plastic pipe into your blood system. Alternative to that is we create what we call a fistula, in other words, a connection between your arterial and venous system. And we have to insert quite thick needles into your blood system so that we can draw the blood out of your body. The blood coming out of your system is then filtered through literally a sieve, a filter. And obviously the technology is much advanced now than it was in previous years, where the machine is able to extract extract the toxins that are unwanted in the body from the toxins that are still needed, as well as in the same vein removing excess fluids that your body doesn't need, and then as we mentioned, filtering pushing the necessary blood back into your blood system.
Okay, and how often would dialysis take place, and what's the duration of it as well?
Dialysis then usually takes place on a 3 times weekly basis. If you're coming for hemodialysis, dialysis is done on a 3 times, basically every second day. Okay. And each session generally lasts for about 4 hours. We have patients who sit for up to 8 hours on a dialysis machine. Generally the bigger patients, or patients who have a bigger toxin load, or obviously your nephrologist or your physician will assess the necessity of that depending on your medical needs. But generally 3 times a week for 4 hours per session.
In terms of the alternative approach,
the peritoneal dialysis or home dialysis, generally patients have to exchange fluid in and out of their abdominal cavity 4 times per day, and each bag remains in the abdominal cavity for about 4 hours. There are other more advanced technologies available where a patient is able to drain the fluid in at night, and there are automated machines that are able to then do the exchanges. Instead of you doing it during the day 4 times per day, the machine can do it on a 4 times per night basis, and which leaves you then free to do your day's work or whatever you want to do during the daytime.
Okay, I know you've seen a lot of patients with renal failure. Can you maybe just explain to the viewers that they can still continue with their normal lives?
Yes.
And just a little bit background, or maybe to give them some
one of the biggest fears that patients have is loss of the ability to live a normal life. Loss of the ability to work is one of the biggest fears, and this is very pertinent to men, especially men, or even women for that matter, who have jobs when they come on as kidney failure sufferers. But generally speaking, once you've been treated correctly, once you've been worked up properly, and once the dialysis has been initiated, yes, there's a period, as one would expect, where the body has to adapt to this new form of treatment. Generally speaking, after a month or two of having this treatment, the body is able to adapt, the patient himself has to adapt, and then life can go on as normal, literally. I have patients who are teachers, who are professors in universities, who are lawyers and accountants, coming to dialysis, spending their 4 hours on the machine, and then going to do a completely normal day's work and living a completely normal family life, obviously with the necessity of regular attendance on dialysis and so forth.
That's excellent. Dr. Arendse, we've almost reached the end of the show. Can you maybe just give the viewers a take-home message?
The most important message that I'd like to give viewers is, if you have high blood pressure and if you have diabetes, or if you have a family history of someone in the family having had kidney failure, it is most important that you have yourself checked up. The most damage gets done when you don't know that you have this condition, and the sooner we can detect kidney disease, the sooner we can attempt to prevent further progression of the disease. And in fact, in some instances, we've even prevented patients from going on to dialysis and needing kidney transplantation. So prevention is better than cure at the end of the day.
Dr. Arendse, it's been a great pleasure having you on the show. We hope to see you again, and we'll probably be discussing transplantation and kidney stones on a later stage as well. Thank you very much once again. Thank you for watching. Stay tuned for another episode, same time, same place, next week.